live. But on your side, what were some of the problems that you saw on the physician's end of it? Because I think everybody understands what we see as the patient, but obviously there's two problems here.
Yeah, that's a really great question. I'm glad you asked it. So I think one of the biggest frustrations from the physician side, especially in primary care, is that there really is not time or a environment in order to be able to address those root causes with your patient. So you have someone come in for, what might be a 15 or 20-minute office visit, because of the way the insurance system is structured. You have to see a certain number of patients a day to keep the office open. It means you don't get to spend a lot of time with each person. In addition to that, there are ridiculous amounts of documentation requirements, so that oftentimes, the doctor's typing on the computer while you're seeing them. There's just not a lot of time. So say someone comes in with, high blood pressure, high cholesterol, and their knee hurts or something, and you've got to talk about all those things in 15 minutes. And really getting to the root cause is going to take more than 15 minutes to talk about. Let's talk about your exercise. Let's talk about what you're eating. This is a much bigger conversation. So I think that is probably the biggest frustration, is not being able to have the time and have the relationship with a patient to actually help them improve their health. And so for me, that was something I identified early on. I wasn't going to be happy practicing in that type of a system. And I see a lot of my colleagues, even who are only a couple of years out of residency, already looking for other options, because it's just so unfulfilling to feel like you're having to practice in a way that's not consistent with your values. So I had always known I wanted to go into more of this direct primary care model, which is gaining a lot of popularity among primary care doctors as a model that really allows the doctor, it just puts the doctor-patient relationship back at the center, and allows you to have the time to be able to work on these things.
Is that because it sounds like what's at the crux of that, or maybe what actually is at the crux of that, is the way insurance is designed to interact with both the practitioner and the patient. Are we circumventing insurance at this point?
Yeah.
Okay.
So the direct primary care model, it's called direct primary care because there's a direct relationship. Both, one, you get the face-to-face relationship, but also financially. So the patient's directly paying their physician for primary care. The physician is not billing insurance. And that's different from when you hear concierge medicine. The concierge model means that the doctor is still billing insurance, but they're also charging the patient an additional sort of membership fee to be part of that practice. And that's, again, just to allow them to be able to spend more time with the patient.